Good evening and welcome attendees. The AOA Advanced Degrees Open House will now begin. Having said that, the American Osteopathic Association is pleased to host this open house, and we thank you all for joining. We're going to jump right in and provide an introduction to our panel. Tonight, we are joined by staff and faculty from Moines University and staff, faculty, and alumni from St. Joseph's University to introduce you to their respective programs and detail the unique value that they are offering exclusively to AOA members. My name is Shannon Gillen, and I'm a project coordinator for the AOA, and I'm going to be moderating tonight's discussion. Representing the St. Joseph's University MBA program, we have John Dart, the program manager overseeing the graduate and executive education, and Dr. Tani Jampullingham, a professor for pharmaceutical and healthcare marketing. They're also going to be joined by Dr. Franklin R. Gergitz, an alumni of the SJU MBA program. Representing Des Moines University's MHA program, we have Dr. Rochelle Ramir, who is an associate professor and chair of the Department of Public Health, and Dr. Simon Galetta, who is also a professor within the Department of Public Health. Tonight's open house is a moderated panelist-led discussion. We are first going to give an overview of both institutions and their unique offerings. And from there, we're going to open the floor for 45 minutes to allow for listener questions. Since the Q&A is led by our attendees, we ask that you please type any questions that you may have into the chat functionality of our WebEx platform, and we're going to try our best to ask as many relevant questions as time allows. Our panelists are very excited to hear from you, so please be sure to submit and direct all questions to your specific program of interest. With that in mind, it's helpful to understand why the AOA has created our Advanced Degrees program. After speaking with many individuals in the osteopathic community, we are very interested in learning about the business of medicine and how it can be coupled with the clinical delivery of medicine. Thus, we've partnered with Des Moines and St. Joseph's to offer our members an additional outlet for professional growth with a deep focus on delivering value. At this time, I'm going to turn over our presentation to our panelists from St. Joseph's so they can introduce their MBA program.
Hi, thank you, Shannon. This is Jonathan Dart, dialing in from St. Joseph's University. I'm joined with, as we mentioned, Professor Jamalingam. Tani, if you might want to call in, I had some audio issues, and also Dr. Franklin Gergitz. And just to introduce St. Joseph's University, and our partner, the Philadelphia College of Osteopathic Medicine. St. Joseph's University is home to the largest Jesuit business school in the U.S., the Halb School of Business. We've had a long-standing partnership since 1989 with the Philadelphia College of Osteopathic Medicine in offering dual degree programs for DOs. So we've offered business education programs for medical students that wanted to leverage their business acumen so that they can transform clinical experience into business success. So here pictured is our class of 2018, actually about half of them. I have to say it's a rare treat for a 100% online program to be able to see our online students face-to-face. So I have a similar picture of our class of 2019 I'll have to send to update. And we've had this partnership for over 30 years now. We've leveraged this into an executive model, which I'm presenting this evening. And St. Joseph's University, as a Jesuit business school, regardless of religious affiliation, our Jesuit identity is tied into business ethics as well as educational excellence and an ideal called cura personalis, which fits perfectly with the osteopathic credo of care for the whole person. Now, what makes our curriculum so different is compared to a traditional MBA program, where you might have an opportunity to pick a concentration, even if it's within a healthcare field, that really constitutes 3 elective courses. Whereas our curriculum is a little bit different. It is comprised of 20 classes where each class is actually focused through the lens of healthcare delivery. So even if this is a busy slide, the one thing I would like you to take away from this is that this is an MBA. you do cover the accounting and the finance that you would get as a hallmark of any MBA. However, there's a breadth of industry-focused topics that you might find within a specialized master's program. Within the MBA courses, the accounting, the finance, everything is, as I said, still taught through the lens of healthcare. So for an example, the accounting modules that you'll take, yes, you're going to be looking at standardized financial statements, but rather than looking at any Fortune 500 company or an annual report for, let's say, a General Electric or a Home Depot, you're actually going to be looking through the lens of a healthcare practice or a healthcare network's financial statements. And in that way, you'll be able to apply these areas of business acumen directly from a day-to-day basis. We do also offer a standardized waiver and exemption for 4 of our classes, which represents significant tuition savings as well as the discount through AOA membership. This is a 100% online program, and it is AACSB accredited, which is the highest accreditation that a business school can receive internationally. One other thing that I'll note is that you will earn CME credit in both of these advanced degrees modules, whether it's the MBA at St. Joe's or the MHA with Des Moines. And if you're going to put in the investment of obtaining an advanced degree, why not earn the CME credit that you otherwise would be having to obtain during that time frame? So we've expanded our partnership with the Philadelphia College of Osteopathic Medicine, who will endorse our students for up to 480 CME credits during the 2-year period. Which brings me to our next slide. So our online course structure is pretty unique in that each course corresponds to the calendar month. So you begin a course on the 1st of the month, and by the end of the month, whether it's the 30th or the 31st, you actually finish that class. The courses are comprised of a weekly webinar, in addition to assigned readings, threaded discussion, and anywhere from 2 to 4 deliverables or assignments throughout the course. These online lectures are held at a standing appointment time at 9 p.m. Eastern, which gives us access and availability for students who are on the West Coast. And they last 60 to 90 minutes. These are recorded for later reference, so if for any reason you have a time conflict, you can always go back and view the recording. So one of the benefits of going through a program like this with a 1-month structure is that you have the opportunity to dive into one topic at a time, which is very important for adult learners. So our program is designed intentionally as a cohort. So you would begin the program from start to finish with a group and go through a prescribed sequence of classes. And you would have a break in between each semester. So every December, every April, every August, you would have a bit of breathing room. And in that way, you can go through in a very structured manner. We try to make it as easy as possible, understanding that it may have been some time since our students who are coming into this program have actually been in a classroom. So our admissions process is very streamlined. We require a simple upload of your resume or CV. We do require a minimum of 4 years of industry experience. We require 1 letter of recommendation, so anyone who you might have indicated as a reference on your resume or CV would be appropriate. We'll need your official transcripts of your undergraduate and medical studies, as well as current AOA membership, and all of these will afford you the discounts that are offered through this partnership between St. Joe's and AOA as part of the Advanced Degrees program. So with that, I'll get to some more details once I go through some of the Q&A sessions. So at this point, I'd like to kick it off to Des Moines University and Dr. Rochelle Reimer.
Thank you, John. I first need to apologize to everyone because my voice is a little bit rough, I managed to come down with a little case of laryngitis just this afternoon. So a good treat for our time together. But I'm pleased to be with you today and to talk a little bit about the Des Moines University MHA program. Many of you are likely familiar with Des Moines University. We are one of the largest producers of family practice physicians in the country, and we're the second oldest osteopathic medical school in the country. I want to start with our mission to mention that our mission is to improve the lives in our global community by educating diverse groups of highly competent and compassionate health professionals. Our entire university is focused exclusively on healthcare, health promotion, and we are competency-based, and you're going to see that thread through the rest of my comments. But what you're probably most interested in is our curriculum. And so what we have is a 48 credit hour Masters of Healthcare Administration, and it is designed after, and very similar to many MBA programs or Masters of Science in Health Administration. There's many different degrees that you can get in this area. What sets ours apart is the 3-block structure and the focus on healthcare competencies. So you'll start in block 1 with a professional development seminar, starting to talk about those essential leadership and managerial skills that you're going to need as a healthcare manager. Then you'll take the business courses that are thread throughout the curriculum as well. So you'll take actually 2 healthcare financial management courses and a healthcare economics and policy course, ethics, and a lot of in-depth information about how to lead, manage, and run a healthcare organization. Our entire curriculum is based, like I said, on healthcare competencies. And so just like what John said from St. Joseph's University, in our curriculum, you'll also get this focus on healthcare management. So when you're taking your Finance 2 course, that course is going to have your traditional sort of financial management exams and assessments, but it culminates where you create an integrated financial forecast for a healthcare system. And so what we're doing in our competency-based courses is asking students to create deliverable products that are useful to them in their current professional environment, that are beneficial to their current employer, and are giving them real applied skills in the healthcare field, starting with the first class. We are CAMI accredited. We're one of only about 100 programs that are CAMI accredited, and that's exclusively for healthcare management education. And we recently received 7 years of accreditation, which is the longest accrediting period that that agency grants. We also have endorsement from the Iowa Department of Public Health because we offer the long-term care internship as one option for our culminating experience, which we can talk about more in a moment, to support our students who want the nursing home licensure credential. So we have many students who pursue that as well. We have strong connections and partnerships with the National Council on Administrative Fellowships to help our students beyond their MHA degree, and we are closely tied with the AUPHA, some of the leading organizations in the field. Our courses are scheduled in 3 blocks per year, and our academic terms are 12-week terms. And we're structured very similarly to a traditional semester. So you start a course or 2 courses, however many you decide to take, and you would do that throughout the 12-week term. Our schedule of enrollment is fairly flexible. Students can choose from a 2- or 3-year program of study to complete their master's degree. They are not locked into a set cohort because we understand that working adults may have changes in jobs, and we want to allow for that flexibility. That being said, our 12-week terms are not self-paced, so you work through the learning community in your course. There are set assessments, but there are no required live sessions with this degree because it's 100% online. Similarly, with St. Joseph's, through our partnership, we grant CME credits with the support of our CME office. Students who complete our degree also receive the Kaiser Permanente Diversity and Health Series certificate, which is embedded into our curriculum. And so as they're completing their courses, they're also making sure that we have that focus on diversity and culturally competent care. Another unique aspect that we think sets us apart is that every student receives a personal academic and career counseling coach by a full-time faculty member on campus. So even though this program is being delivered online, there's a real professor sitting in a real office on this campus who is committed to your success, who is here to answer your academic questions, provide you with career counseling and coaching, and help you link into our professional networks for your career advancement needs. In order to apply for the MHA program at Des Moines University, I'm having trouble advancing the slide. There we go. Oh, I skipped it. I wanted to mention also our outcomes are very strong. So like I said, we recently received the 7-year accreditation from CAMI, and one of the high emphasis points for CAMI is our continuous quality improvement within the program. And the second is our competency-based education, which I've also mentioned. Our 2018-19 cohort had a 100% employment rate, and most of our graduates are employed in hospitals and healthcare systems. Our current students currently reside in 23 states, and we have alumni all over the country. So by joining our MHA program, you'll have a strong network of alumni from the healthcare administration field and of course from the healthcare delivery field. Our faculty are experienced industry professionals, and they are engaged in applied research, and they're publishing in peer-reviewed journals. But most importantly, they're committed to our students' success. In order to apply for our program, you need to apply directly online at www.dmu.edu. We require a CV or a resume which highlights your relevant healthcare work experience. We don't have a necessarily minimum requirement, but we do prefer, of course, some relevant healthcare experience, and emphasizing any leadership that you've taken on in your past career is very helpful. We ask for 3 letters of reference, preferably from managers, employers, and academics. And we ask for a statement of purpose and objectives to ensure that you can identify for us the goals that you have at the end of our degree. And of course, we require official transcripts. With that, I'll be happy to turn it over to initiate the question and answer session. And I'm happy to answer any questions that you might have. And thank you for taking the time to listen to my information about Des Moines University's MHA program.
All right, thank you so much, Dr. Ramir, for the thorough overview of the Des Moines MHA program. We are going to begin our Q&A session based on the questions that our attendees have submitted. The first question is, what type of employment do graduates experience upon completion?
So I'll start with that. If you can still hear me okay, this is John Dart from St. Joe's. So the outcomes in career advancement among our graduates runs a full gamut, and really comes down to where that individual student is in their existing career, their age, their specialty, wherever they may be. Our students represent DOs who graduated med school between 1980 and 2011. So some are, in mid-career, some are in a more senior level of their career when they are graduating the program. Some advance into administration roles. They may be medical directors of a service line, or obtain different administrative appointments within their hospital or their healthcare network. So medical directorships, VPs of different services, even chief executive or chief medical officers. We've had a few students progress into those types of positions, whether they be in private practice. They may be expanding their practices, and some even transition into medical education. So directors of residency programs and even deans of colleges of osteopathic medicine have graduated within our program. So also we do have another type of typical track. Some physicians who are experiencing various levels of burnout might be wanting to transition into leaving a clinical setting so that they can maybe become a medical science liaison for a pharma or a medical device company. So it does run the gamut. So I think it would be a great opportunity for me to call on one of our alumni, Dr. Franklin Gergitz, who is with us this evening, to tell us about his career progression following the program.
Hi, my name is Frank Gergitz. I'm a board-certified otolaryngologist in private practice in Scottsdale, Arizona. My history is quite unique in that I think it was 3/4 through my study at St. Joe's when my practice in Northeast Pennsylvania went through a fairly radical change in that the dominant insurance carrier in my area started selling a low-cost narrow network insurance plan to the major industries in my small community. And before I knew it, my population of patients was changing away from me. I tried to negotiate my way into the insurance plan, and the only way that I could stay in practice taking care of the patient population that I had already established was to sell my practice to the insurance company and to become an employed physician. So that was not my goals, and what I decided to do was to look elsewhere. And I don't know if I would have been able to have the confidence to do that had it not been for my business knowledge that I gained while going through St. Joe's. A few of my other colleagues and my classmates, like John was mentioning, some of those people have become hospital-based healthcare administrators. One of my colleagues was in the military, and he had advanced in his military grade. Another one of my fellow students, thanks to Dr. Tanny, in one of our classes, she was discussing a possible ophthalmology invention, which she did launch after our classes had met. One of my classmates had become a PCOM hospital administrator. Another one of my friends and classmates became the manager of his group medical practice. And I think it was a great experience for myself. And I strongly encourage anybody out there who, remember, we're taking care of patients on a day-to-day basis. And the current changes that are taking place in the medical economics happen faster than we can imagine. And having this set of skills and this experiences that I've gathered not only provided me the confidence to close down a practice in North Central Pennsylvania and travel across the country and open up a brand new practice that's skyrocketing out here in Arizona, where I don't have the same restrictions of my population of patients like I did in Pennsylvania. So I encourage you to look into the practice, the programs at St. Joe's and Des Moines. I think that was a very, very beneficial practice adjustment in my life. Thank you.
My turn. Des Moines University here. So I would echo a lot of what John said about the types of places our graduates go. The vast majority of our graduates go work in a health or hospital system. That's the typical place of employment in our region. And we have them go to a variety of different locations. So just like John said, vice president of different service lines. Many of our students do strive for that C-suite someday. And so I do have some commentary from a recent alumnus who graduated with his DO and his MHA degree. And he's currently the chief medical officer and medical director at a county, Grundy County Memorial Hospital. He's an internist and a pediatrician, and his comments to me were to say that he decided to pursue his MHA in addition to having gotten his clinical degree as a way to better understand the changes in the healthcare that were occurring around him, just similar to what our other panelists said. And he says, the only constant in healthcare is change, and my studies in DMU's MHA program provided a foundation, which I have built a knowledge base regarding healthcare, financing, and policy. As a result of this, I'm better equipped to assist my clinic and hospital navigate these changes. In addition, being able to articulate the quote-unquote why behind changes to clinic and hospital frontline clinical staff has been helpful in onboarding them with various initiatives. My MHA degree has been beneficial as I've built my combined internal medicine and pediatrics practice and has provided me information that serves me well in my various roles, including hospital medical director and governance roles on a variety of hospital and system-wide clinic subcommittees. So I would say that the vast majority of our graduates continue within the healthcare field. Many continue to see patients, but we do have those that want to move into owning their own practice and taking more advanced leadership positions within their current organization.
Well, wonderful. Thank you so much for those. We have our next question as, do you offer any career placement services?
So this is DMU. We don't have a particular career office that supports our MHA students. That service is delivered through our faculty members who advise and mentor their students. We connect our students with our existing professional networks, with people who have hosted our students in the past, our existing alumni. And so we don't have a centralized office for that, and we don't do career placement, but we do a lot of mentoring and career counseling to ensure that our students wind up with culminating experiences and job prospects that meet their career goals.
Thanks, Rochelle. I'll chime in for St. Joe's. So we have a on-campus career services department that services both our undergraduate and graduate student populations. And in addition to that, we actually have a graduate student mentor, Dr. Tricia Rafferty, who will advise our students one-on-one, regardless of where they are within their career and what kind of transition they're trying to make. So that can be as simple as resume review, a basic service, or it can be more of an internal networking. Again, we would, just like Des Moines, interface with our faculty to create those types of connections. And the only other thing I would add to that is, as part of our leadership and development track within our curriculum, we offer executive coaching. So we've retained an executive coach for our EMBA students to guide them through whatever individual objectives they might have. So this is kind of a supplement into what they would do for their leadership and development and their management track as part of their business acumen series. So they will have access to those resources as well throughout the program.
Okay, wonderful. Next question is, what is the median income after graduation versus physicians without a master's degree?
So I'll start off with this. So we've tracked through the Executive MBA Council, EMBAC, and The Economist that the range in career, salary growth immediately following an advanced degree program can be from 15 to 50% increase in salary. So it does depend on the individual student's area. So obviously a spine surgeon is going to be making more than a family practice physician. But if you look at a percentage, we've tracked between 15 and 50% increase following graduation. So there may be some additional metrics that Rochelle might be able to offer.
That's a good question. I wish I actually had a better answer for that. What I do know is that our overall average of median income for our graduates post-graduation is approximately $80,000 a year. So that clearly does not reflect the median income of physicians who take on an additional degree. And it also depends on whether or not those physicians choose to take on a new position within that short period of time. So I know that most of our physicians, or about 80% of our current students who graduate, then say they do receive a promotion or an advancement based on having received the degree, but I can't link that back to a specific dollar amount. So sorry, John, I don't have more information.
No, that's perfectly fine. Yeah, I mean, like we're pretty much in the same, like we're looking at percentages because it's different. It is difficult to quantify because, as you know, with your student population, we're all over the U.S. So, yes, there are different economies, microeconomies that exist and different specialties. So, but if you look at it at a percentage, what it comes down to is that, physicians with an advanced degree do have more opportunities available to them.
Absolutely.
All right, thank you so much. Next question is, what is the placement rate post-graduation?
Yeah, so it's this is Rochelle from DMU. It's my turn to start off. This one's really simple. We have a 100% graduation rate, and that's measured 90 days after graduation. So we're pretty proud of that. That was 100% for the 18-19 year. It was like 97% after that. That also does include students who go on to take additional education or fellowship opportunities too. So, Joe or John?
Yeah, absolutely. So similar trend. I mean, generally speaking, our student population typically skews, for folks that are in their late 30s and the average age being in their 40s. So they're already pretty established in their career. So we track 100% employment rate for our graduates.
Okay, wonderful to hear. Next question is regarding the program cost. And we also want to know, what are some options to finance this degree and the cost for AOA members specifically?
Okay, great. So the program cost for AOA members specifically, so I'll give you the sticker price is $58,000, and the duration is 2 years. So as you saw before, that's over a 2-year period. Um, so I'll talk a little bit about how that's broken up by semester. So it's based on it's billed per course and per semester. So it's not like a one lump sum amount that's due at the beginning of a program. It's basically, and I would assume this is the same among most institutions, that you're only going to be billed per enrollment per semester.
For Des Moines University, the total program cost comes out at about $31,000 before any of the discounts that are available. The duration is actually fairly open. Students have up to 5 years to complete the degree, but what we give to students is a 2 or 3 year plan to get them started. Most students want to get those credentials and move on with their career. So we have 2 and 3 year options available. Options to finance the degree are your typical student federal financial aid, private loans, or self-pay. About half of our students also have employer-based support. So one unique aspect of the AOA partnership is that some employers are likely to allow students to use their CME dollars in order to support the funding for their enrollment. So that's a good opportunity to explore that. And we have a 10% discount, obviously, with the AOA partnership for that tuition.
And I would also just like to add that, obviously, between institutions, St. Joe's also has similar payment options in terms of, typical financial aid and deferment payment plans. Would also just like to add that the tuition for an executive program, one of the tenets of an executive program is that it's pretty much all inclusive, so that you're receiving textbooks and course materials with that.
Yeah, and that's a good differentiator because our program does not include textbooks. So you pay tuition based on enrollment, probably similar to that program, but textbooks and computers and things are not included in that.
Right.
For us.
Okay, and the next question kind of feeds off that same one. There's a lot of interest in knowing the starting points for each cohort throughout the year.
Okay, so we do enrollment basically every semester. So we do classes start at the beginning of September, the beginning of January, and the beginning of May. So we accept applications all year round. Typically students are interested in starting the program at the first available opportunity that they can. So we're currently accepting applications for our fall semester, and those classes begin September 11th. So we're reviewing applications and accepting those currently.
Okay, so St. Joe's program, we have intake periods in September and February, basically. So we are currently still recruiting for our September cohort. So classes will begin September 1st. We will be admitting students through the month of August. I do encourage anyone that's interested in applying that you do so by let's say August 1st as a guide, because that will give us some buffer time to obtain any outstanding items such as transcripts and letters of recommendation. But again, we will have intake periods in February as well.
All right, great. We have some questions regarding the program rankings. Can you elaborate on those?
Is it my turn?
Sure, yeah.
So, okay, so the EMBA program at St. Joseph's University, ranked by U.S. News and World Report, is 12th in the nation among executive MBA programs, and that is without any additional qualifier, regional or whatnot. That's a national ranking. I would like to point out that, if you look at our listing among our peer institutions in this category, we're number 12. We're number 2 in the Philadelphia region, second only to the Wharton School of Business at Penn Medicine. So, in addition to that, the Halb School of Business is really known for its niche programs. We have highly ranked programs within food marketing and other specialty marketing programs such as pharmaceuticals and other healthcare tracks. as well as our AACSB accreditation.
That's a good segue. So Des Moines University has actually made the interesting decision to not participate in the USA World News ranking system. I think there were some initial questions about the methodology, so we do not participate in sort of the peer ranking system that is a part of that. That being said, we do get lots of solicitations from organizations that rank online programs. We're consistently in the top 10 or top 15 of MHA programs, which of course is a sort of a separate discipline and would be in the MBA rankings. But we get very high marks on those things for our online program. When you combine all factors such as the curriculum, the affordability, the student evaluations of their experience here. So I don't have a definitive number to answer that question, other than to say that we've chosen as an institution not to participate in the US News World ranking, which actually has something to do with the fact that some of our our accrediting bodies prohibit some of our specialty programs from doing so. So there's a long story behind that, but we're not in that.
All right, thank you. Next question, what are your faculty qualifications?
That must be Des Moines University's term. I'm actually going to have Dr. Simon Galetta answer that question. He can speak to the faculty qualifications and their how they coach and interact with our MHA students. So I'm going to turn it over to you, Simon.
Oh, thank you. So we have a diverse faculty, diverse in terms of qualifications and specializations, I should say. And I think one thing that distinguishes Des Moines University's faculty team is that we have some level of experience in the industry of healthcare leadership or healthcare analytics. So we somehow got together here with some background of, academic training, terminal degree, of course, and in addition to that, healthcare experience. Now that includes both the full-time faculty, primary faculty, as well as the adjunct faculty that we use. The adjunct faculty actually are individuals who are currently practicing in healthcare administration positions throughout Iowa mainly, but throughout in other states as well. So I think what the advantage of this kind of unique position is our education, our classroom didactic content is full of actual practice, exact current going-ons are discussed in the classroom, and that kind of creates a lively learning experience for our students.
Thank you.
Okay, thank you. So from St. Joe's perspective, I'll invite Dr. Tani Jamalingam if he would like to respond to the question.
Thank you, John. Hi to everyone for participating for the event tonight. With respect to the qualifications, almost a majority of our faculty have PhDs, MDs, registered pharmacists, MBAs, and JD, law degree. With our faculty have these qualifications or combinations thereof. Almost all of them have worked in the industry before, whether it is a pharmaceutical industry or have worked in the healthcare space, healthcare industry. So that's kind of the diverse background they have with work experience. Almost all of them do consult on a regular basis, and I do as well in this space. So that way we know the pulse of the market and what's happening in the environment, and we try to bring them to the classroom. For example, recently I was one of the expert witnesses for the opioid case that's going on the federal level. And I served as an expert witness, and I learned a lot in the process. I do have protective order on what I can say and what I cannot, but the learning process is there, and we are going to bring that to the class one way or the other for students to really understand the issues and how they deal with it. Also, some of us have went through the case method of teaching, and I went through the training at Harvard as well, in order to understand how we apply this case method and examples that we can bring it to class so students can benefit from it. And also, we try to integrate everything that the students learn, especially when they do the capstone courses. So I will keep it for that discussion later, but they're highly qualified, excellent healthcare experience, and they try to bring that to the class. As we are dealing with very experienced students, we need to make sure that we meet their needs. Thank you.
Great, thank you so much. All right, next question. What is the completion rate of each program?
So I think it's my turn again. So our completion rate is, I would say, 99%. So we typically cap our cohorts at 25 students. So we typically might have one, maybe two students that choose to not pursue the program after the first semester. And that can be under a number of certain reasons, often just times due to time management. As it comes down to it, life events happen, and we perfectly understand that with adult students. But we do fully support and understand those situations as they happen. So, if we recruit a cohort of 25, there might be one person or two people that do not continue through graduation. So the graduating class might actually be a couple students fewer.
Yeah, we have a very similar student body. So the vast majority of our students come in are juggling full-time jobs, and they have lives, and many of them are in that sandwich generation where they're both caring for children and taking care of aging adult parents. So we measure our graduation rate based on the very first time that a student even starts our program. So if they sign up and start even a single class, we count that as a started student. And as a result of that, we have about an 80% graduation rate. And that's partly based on the fact that our students do have a little bit more flexibility in the amount of time that they can take and exploring the degree. But that includes students who are not already physicians. So that's students who may be fresh out of college and who are just starting their healthcare career, all the way up to our more seasoned professionals. So that's a broad snapshot of our student body.
Wonderful. All right, next question. How long has each program existed?
Oh, that's a good question. Our program has been around since the mid-90s. We started our program as like with old teleconferencing materials, with online classes, face-to-face or correspondence courses, face-to-face classes here on campus, and our faculty actually would travel to other locations throughout the state to deliver our courses. We started in the mid-90s. We received our initial accreditation in 2015 and then had our reaccreditation in 2018. But we've got some history at the university.
Okay, so from St. Joe's perspective, as I mentioned before, we've been doing dual degree DO MBA programs with PCOM specifically since 1989, so about 30 years. This executive model, this online model, is a little bit more recent. We've initiated our online model for our specialty programs in 2001. And this program really took off with the rigor of the healthcare focus for physicians as a real innovation, I would say, in 2013. Prior to that, we had been in contract talks and developing with our faculty a specialized program for one of our local hospital networks, Lancaster General. So we actually put together a customized program for LGH that was really, I think, a renaissance for the program as it exists today. So, loaded answer is 30 years. More honest is, probably within, as it exists right now, I would say about 6 years.
Okay, great. All right, next question. What technology is needed as classes are all going to be taken online?
So I think it's our turn. So basically, you need a relatively recent computer and a good internet connection. With those two things and access to your textbooks, that's what you'll need. All the software that you need, say for your statistical analyses and your courses, any additional software that you might need to participate in anything for your classes, that's all going to be delivered through our online learning management system. So we do suggest that if it's been a long time since you've been in school and you're a little less familiar with technology, that there's some things we can do to help you get more comfortable and onboarded and lots of training. But really all you need is a good computer and a solid internet connection.
Right, and I will echo that. These are both 100% online programs, and the internet connection is paramount. We do offer our students standard issue equipment, so we provide laptops and headsets and things like that. We do also offer software packages that are standardized for basically whatever our faculty require. We provide to you, but that. Being able to connect online is most important. And, I think it goes to say, if any one of the attendees that are joining us this evening are with us, then you pretty much have met the criteria. St. Joe's uses this same platform, Zoom, that we're currently meeting you with this evening. So, just making sure you have that connection, is going to be the most important thing for an online program.
Mm-hmm.
All right, wonderful. Next question. Can you provide any details about your Capstone course?
So I think it's St. Joe's turn. So I'm going to turn it over to Dr. Tani as well as Dr. Gerges if he wants to chime in as well. So Tani, why don't you talk about our Capstone experience a little bit?
Absolutely, yeah. So our Capstone course is at the very end of the program, and our goal is to make sure that the students, whatever they've learned with respect to the knowledge that they accrued, and also the skills that they need to have in order to become an executive. So the goal is to integrate the knowledge that they've learned in the program and also develop their skills in building strategy with respect to whether it's a business plan or even developing a service line or even developing some type of corporate strategy. So we work with the students to make sure that they do that effectively, and they do by doing it, in the sense that by really building those programs, projects. The teams are basically, assigned, where we look at the skill sets and the backgrounds and the expertise that they have, and they put the teams together and they do the projects where the students make those choices for the projects. Once the project is chosen, we actually, develop the projects with the students in order to make sure the projects come about as they were supposed to. So with respect to the projects, mostly they are process of developing a strategic business plan. Financials are involved. They may have to calculate a net present value on ROI and return on investment on those projects. We make sure that the students use data in analytics, use their innovation course they've taken in the past, integrate some of the new creativity in those projects, and apply competitive analysis, market research, and other topics in order to enable them to develop the best process to build those projects. To kind of give you a top line, I'm going to talk about a few of these projects just to name them. Recently, I just completed, almost last month, 3 capstone projects from one health system, which have given us about 16 physicians who went through the program. One of the projects was artificial intelligence in reducing length of stay, which is a very specific project. Telehealth in psychiatry, and mobile health strategy, where you go into the communities and provide care. All these 3 projects, the students developed the projects, identified the cost and the revenue issues with respect to how this is going to impact their profit and the bottom line, look at the social impact, and then they did complete financials, both on the cost side and the revenue side, and they were actually presented this to the senior leadership within the company that they are part of, and it gives about an $8 million revenue impact on the company, on the health system, I should say. And in fact, the CEO told me that they actually are going to go ahead with all those 3 projects for implementation. So it is really directly related to the outcomes. A similar group with 3 projects was done before that. 2 of those 3 projects are already ongoing as implementation. With respect to programs of this kind, the PCOM program we did and the AOA program, which I will probably see them soon, they will be teamed up based on their common interest, and they would be able to develop those projects. We do invite some of the leadership within those systems to participate in order to give us input, and we would be able to make sure that they're invited for the presentations as well. The CEO of PCOM was very involved in branding the PCOM system and the healthcare services that they have. And in fact, the students were able to present them back. So these are the kind of the breadth of projects we do. We want to see real world impact on the companies they work for, so they can take these projects back to an effective outcome, which actually leads to some of these people. In fact, the vice president of operations mentioned to me that the leaders of these teams are going to take the leadership on those projects in the company, in the health system, to move it forward. So before I complete, I want to make a comment about Frank. Hi, Frank. I didn't know you were going to be on call, but you did mention about this company, about the ophthalmology company that somebody was trying to start. I hope you're working on your project that you did on sinoballoonplasty. If I remember, that's your project that you worked on for controlling migraines.
Yeah, hi, Tony. Yes, I did. In fact, I have been awarded the patent that you helped me get. So now we're in the process of actually putting that to active use in anesthesia and helping with migraines and headaches and assisting the anesthesia for in-office nasal and sinus work.
That's awesome. Continue the good work.
Yeah, thank you. And I just wanted to echo some of Dr. Tani's points. It was the Capstone project was very well organized. It was 2 months. We met on a regular basis with our groups. Our group was, I think, 4 or 5 students. We became very close. Multiple professors had helped. We also had a CEO from Jefferson who was available for us as well for questions and answers. Yeah, and our topic was the future of primary care medicine and try to give a snapshot of what it would look like in 10 years. It was very pertinent, it was very applied, and I was also wanted to share with everybody that I was very pleasantly surprised about how my studies at St. Joe's applied to my personal practice. So I thought that was very helpful, and it kept me engaged in the 2 years. And it went by in a blink of an eye. Half of my time was spent in Pennsylvania, half of it was in Arizona, and I really enjoyed it. I really encourage everybody to consider these programs.
That's fantastic. I will speak for Des Moines University and say that what you've said about the culminating experience at St. Joseph's is very similar to what we have here. Our students take a semester-long project where they work with both their faculty advisor and they work with a preceptor out in the community to identify a project that really draws upon the health administration competencies that they've learned throughout the curriculum and apply those to a very real-world problem and bring value back to that organization. So, things like data analysis, doing policy reviews, healthcare quality, strategic planning, all of those different things would be well within the scope of the type of projects our students do. Students in our program, though, especially our physicians, typically work within their current healthcare organization. So they may take on a quality improvement project, a policy issue. They might take a piece of the community health needs assessment, for example. And they work individually within their organization to create a deliverable product that brings value back to that organization. Again, echoing what you heard from St. Joe's, the goal is to take this didactic preparation that you've had throughout the degree and create a tangible product that brings value back to your organization and allows you the opportunity to demonstrate all the skills that you've gained. The one unique thing I would say is that one differentiator is that our students don't do group projects, given that everyone is all over the country and working in their own healthcare employment settings. The students have the opportunity to do a group project, but typically they do an individual project. The other additional opportunity that we have, which is less appealing for our physician students, but it is otherwise an option, is if somebody wanted to pursue the long-term care administrator track where they can get the nursing home administrator license. Students could do that route as part of their culminating project also. Otherwise, I think that everything else is pretty similar, and I don't have anything more to say.
All right, wonderful. We do have a question specifically for SJU and John. We have a question here. How long do you have to complete the program if you decide to skip a class or a certain amount of time?
Sure. So I'll jump into that. So obviously, having a prescribed sequence of classes has its own challenges, which we completely understand. So from a short-term perspective, if you're talking about missing one of the online sessions during a week where you have a time conflict, that really is just between you and the faculty member. Those sessions are recorded. You can always go back and review the archive and whatnot. So what happens when you have to miss an entire month if you get derailed from this imagined perfect sequence of classes? Well, we actually have a tandem program that we run that is, I would categorize it as more product-oriented versus being service-oriented. So we have a program that we run for pharmaceutical and healthcare marketing that has a very similar one-month online structure. We also offer 2-day courses on our Philadelphia campus that students can use to substitute any class that they might miss within our healthcare EMBA curriculum. And what we try to do is work ahead of time, knowing that these conflicts exist on an ad hoc basis with individual students. So just to give you an example from a recent cohort that we had of 21 physicians and hospital administrators that came through our program, during a 2-year period, we actually had 13, quote unquote, deviations, and they represented honeymoons, new children being born, that they had to take some time off, people that needed to take time off to get recertified for their boards. So we've seen the gamut of life and how things happen with adult students. So we try to work with each individual student to keep them on track. And in the more workable scenario, we try to help you substitute these classes during months when you have off. So as I mentioned earlier, we have built-in breaks. So every August, every December, every April, you have a month off. So we will work with you to help you make up those courses during those times when you have a natural break. So going back to the earlier illustration, we had those 21 students, 13 deviations during 2 years. All 21 students actually were able to graduate during the same time. Now, in the worst case scenario, let's say if it's a more long-term thing, so we've had some students in the military, for example, that had a deployment that had to actually take whole semesters or multiple semesters off. In that case, we would have you stream in with another cohort. So you might start with one group and finish the program with another. But what it comes down to, and I'm sure Rochelle will echo this in a few moments, is that we will work with you to help you matriculate through the full program.
Yeah, I would just say we have very similar policies. We have short-term leaves that we can grant for students. We have long-term leaves. Our program is students register themselves for their courses each semester, so students can decide if they want to take just one course that term or if they want to take a couple of different courses. So there is flexibility in that, but our policies do allow us to give students sort of an official pause out of the program, particularly for the types of life events that John is describing. Those happen all the time for our students. So we try to make sure that we can accommodate those and allow students to pursue their continued education while still fulfilling their personal responsibilities.
Okay, we do have one additional question. What are the next steps if you're interested in applying for either one of these programs?
So I think the next step is to either go to the AOA Advanced Degrees page, and that has information about both St. Joe's and Des Moines University, or you can come directly to either of our websites. We have a landing page there set up for this very thing where you could initiate a conversation with our admissions staff. You're free to contact me directly and ask any questions, or you could start an application right on the website. John?
Hi, sorry, I had my microphone on mute. So just echoing what Rochelle said, it's the same situation. So if you're interested, don't hesitate to either follow through the links through the landing page to submit an inquiry. We'll send you information. You can always contact me directly. I will provide my email address on the chat window momentarily. But basically speaking, if you're interested in joining the next cohort or one of our upcoming cohorts, I do speak with and review the applications for all our candidates. So your first step would be to get in touch. So you can do that through, if you're just passively researching, feel free to go through the inquiry process and look through the information we'll send you. Or if you want to get started, give me a call, send me an email, we'll review your CV or your resume.
Well, great. Well, everyone, that doesn't conclude our Advanced Degrees open house. I'd like to thank our panelists from both DMU and SJU, and of course, our AOA members for attending tonight's presentation. This webinar is being recorded and will be posted on our Advanced Degrees page in the next few days, as well as the ability to request more information from either program. Our AOA customer service team is also happy to assist you regarding this program or any of our other member value programs, and their contact number is 888-62-MY-AOA. Thank you all again for your time and for being an AOA member. Have a good evening.
Good night, everyone.
Good night.
Night.